everyone, and welcome to The Doctor is In on CNN Philippines. And I'm Dr. Freddie Gomez. So, as always, we are here to discuss COVID-19 and answer your many questions about this global health crisis. First things first, though, we want to thank a team of researchers in Finland who shared with us this simulated video. And this shows how viruses like COVID-19 can easily spread, especially indoors. I spoke to one of the researchers behind the video, Professor Ville Vuorinen, and we would like to thank Professor Ville and the rest of the team behind it, including those from the Finnish Meteorological Institute, Aalto University, VTT, University of Helsinki, and IT Center of Science, CSC. Thank you for sharing this video with us. There's definitely a lot that we could learn from this. And this video is also a good reminder for us to practice social distancing to stop the spread of COVID-19. Also happening in many parts of Metro Manila, especially, is mass testing. The national government's initial target is to be able to increase capacity to 2,600 to 7,000 tests per day this week. By April 20, the goal is to conduct 4,400 to 9,800 tests daily. The government hopes to be able to do 13,000 to 20,000 COVID-19 tests per day by April 27. That's 3 days before the end of the Luzon-wide enhanced community quarantine. So mass testing is critical for finding those people who may be spreading the virus without showing symptoms. COVID-19 can spread directly and easily between people in close contact. Controlling the spread of the pandemic then demands finding the infected and isolating them until they can no longer spread the disease. So with an untold number of the asymptomatic or mildly symptomatic persons, the only option to find out who truly has the virus is to test. Okay, and to discuss more about this topic, here with us is Dr. Raul Destura. He is the Deputy Executive Director of the Philippine Genome Center, who also invented a low-cost COVID-19 testing kit that was recently approved by the Food and Drug Administration, or FDA. Welcome to the show. Welcome to The Doctor's In, Dr. Destura.
Hi, thank you so much for having me here, and good afternoon to the listeners and those who are watching.
Now, Dr. Desura, why are the test kits significant in lowering the cases of COVID-19? Bakit ito napaka-importante?
Well, the most important thing there is active case detection. So if you get to identify cases, and you can do effective contact tracing, and at the same time, we'll have an effective control of the disease from for the patients infected to stop the transmission to other individuals. At the same time, it also allows the government to determine the burden of infection in the country and can provide a response based on those particular data. Third, it will actually provide information on when to enhance further community lockdowns or relax for community lockdown. This is some of the information that testing can actually provide.
Ngayon, yes, Doctor. Ngayon, nagsimula na ang mass testing, nagsimula na ito officially. Bakit ito tinawag na progressive mass testing?
Well, it's because it's not similar to the other countries that you test everybody. This is more of like more targeted in terms of people who have the disease and people who have been exposed to the ones showing symptoms, and then and they take it from there. So it's more of like much directed siya. It's not left and right testing in terms of to manage the resources more effectively, and that's what they're doing.
Now, it is also said na ang mass testing ay makakatulong sa pag-flatten ng curve. Ano bang ibig sabihin nito?
Well, if you have already identified cases, it can be linked to where they came from. And from that particular area, there will be an enhanced monitoring of additional cases and more enhanced quarantine protocols that will actually stop the transmission to those who have not been exposed. And by doing that, you are actually able to prevent people from getting exposed again to the index person. And if that's happened, you slow down the transmission, so the peak goes down, in effect flattening the peak, no, the curve, and that will give enough time for the healthcare units, no, like hospitals, no, to be able to manage cases because there will be less uh, the cases coming into the hospital as opposed to uncontrolled transmission. It will also provide better interventions at the same time, management of the resources being done. Because the problem is not just resources, it's actually supply of resources coming in. So if there is rapid utilization because of the uncontrolled peak, we ended up affecting the entire care system capacity at that point.
Ngayon, pag-uusapan natin yung mga resources na kaka-mention nyo lang, Doctor. Ano? But before we do that, yung mga suspected COVID patients, Doctor, paano nila ma-access itong mga test kits? Ito ba'y pwedeng self-administered? Sabay ibibigay na lang? Or paano ba gagawin itong mga tests, Doctor?
These tests kasi are based, which means it requires a laboratory that will run the test, like a PCR lab that has the required and the biosafety protocols in place to be able to run the test. It cannot be administered at home because it needs complicated laboratory setup. And I believe the Department of Health is expanding their testing centers all over the country, and it to be complemented by the availability of test kits from all over, so that it can actually match the demand in the community where the accredited testing centers will be open hopefully soon. So, and I think they're doing double time right now, opening centers all over the country to be able to have better net, you know, of getting cases.
Ngayon, Doctor, sa malalayong lugar, yesterday we were talking about how it's very important for doctors in the barrios to spot those COVID patients sa mga probinsya, sa mga layong lugar, malalayo sa Metro Manila. Paano naman yung mga nasa ganong mga sitwasyon, Doctor, yung mga nasa malalayong lugar?
Yeah, I think that's one of the initiatives they're doing, expanding uh, the testing centers to all of the regions. The challenge really is the availability of testing centers, and not just the availability of test kits, but also availability of testing centers. I think the rule of thumb is it cannot be set up in all of these municipalities is to have a reference testing center near to the area where all of these centers can actually submit their samples. They don't have to be flown into Metro Manila anymore. And that will actually improve the turnaround time and also the base of testing in terms of population sets. I think they are doing that right now. I'm sorry I'm not privy about the whole programs of the Department of Health, but from the discussion for community, that's who are the initiatives that are being done to be able to get more cases even in the far-flung area. Networking laboratories with those with capacity and those who only has the capacity to collect samples.
Okay, yeah, that's okay. But are you able to discuss, Doctor, the actual testing process? Pwede mo niyo bang i-explain sa mga viewers natin yung actually yung nangyayari? Paano yung proseso ng pag-test ng isang suspected COVID-19 patient?
Well, After being clinically evaluated by the healthcare professional, it will be assessed whether this patient will actually require testing. And once it is assessed that they actually require testing, they will collect sample from the nasopharynx, the loob ng ilong, and from the oropharynx, and then place them in the viral transport medium. This viral transport medium will be submitted to the testing centers that have been accredited by the Department of Health, and then will undergo runs using the testing kits that they have and the PCR unit that they have. The usual process is you do them in batches to make it cost effective at the same time efficient. No? You can't do time because each run will take several hours. So you do them in batches. And in part of the laboratory management, either they do it in batches 2 to 3 times in 24 hours or more, no? Depending on the number of technologies that are available in the testing center. So the sample, you extract the nucleic acid material, and once that is extracted, you add that to the testing kits for specific for the corona. You place them inside the PCR machine. It generates a digital data that can be analyzed in the computer, and then the results are released by the testing center. The average turnaround time for that is depending on the number of personnel, the number of PCR machines, 48 hours. The only time it becomes longer is the ratio between samples arriving and then the absorptive capacity of the technology is not matched. So it's not because they are sleeping all the time, that's why it's taking a long time. It's just that there are so many samples against the testing capacity of the laboratory. And that's what's causing the delay.
All right. Well, we'll be discussing more about this with you, Dr. Destura, no? But we have to pause for a quick break. Sa pagbabalik namin ng The Doctor Is In, pag-usapan naman natin ang bisa ng antibodies na panglaban sa COVID-19. At kasama pa rin natin dito, syempre, ay si Dr. Destura. So please stick around. We'll be right back. Hello and welcome back to The Doctor Is In. I am Dr. Freddie Gomez at ang pinag-uusapan natin dito ay ang efficiency ng mga testing. At kasama po natin dito ay si Dr. Raul Destura from the Philippine Genome Center. Siya po ang Deputy Executive Director. So, nakikita ngayon ang potensyal naman ng antibody o ang sariling pandepensa ng tao laban sa mga sakit bilang tugon sa lumalalang sitwasyon ng COVID-19 sa bansa. Here's a statement from President Rodrigo Duterte.
Sabi, by May, baka they would start to market it, pabili na nila. Ang problema, sabi nga ni, we are on the last ladder. Ang muna niyan yung mga mayaman na, kasi marami yan kailangan. Kung meron na yan, tapos makita ko na ginagamit ng tao, ililift ko. Total, kung magkasakit kayo, may antibodies naman tayo mabili. Ngayon, kung wala kang mabili, problema mo na yan. Kasi tapos na yung, I will lift the quarantine.
At para pag-usapan ang bagay na ito, kasama pa rin natin ngayon si Dr. Raul Destura. Siya ay isang microbiologist at infectious disease specialist. Dr. Destura, dun sa speech ni Dr. Duterte, pwede pa explain naman sa mga viewers kung ano ang antibodies at bakit ito importante sa katawan ng tao?
Well, yung antibody, ito yung nade-develop natin pag na-expose, when we are exposed to the disease, no? It takes a while for the antibodies to develop, usually during the part wherein convalescent, no? Wherein the virus is going down and the antibody is going up, which signifies the body is already able to clear the virus. So it has its own uses. Its major use is actually to determine if you've been exposed to the virus already. No? And if you tested positive for that, then it meant that you had a disease. And the other advantage for that is if you are into treating severe cases, some of those have recovered from the disease and it's antibody response that is good. Uh, their blood product can actually be used to treat severe forms of coronavirus disease. So their neutralizing antibody that they developed from their previous illness can be a tool to hopefully reduce the impact of severe coronavirus disease to another person. So that's the importance of having identifying and measuring the response. There are different kinds of antibody testing. There are those that a qualitative test is positive or negative. It doesn't measure how much antibody you have, but it tells you if you have or not. And the, the way that the test detecting the antibody uh, depends on the timing you collected the sample. If you collected it in the earliest form of the disease, it may still be negative, but towards the second week to the third week of illness, it will turn positive. Um, the other form is what we call ELISA, enzyme-linked immunosorbent assay, which is far more sensitive than the PCR testing. It doesn't only identify the antibody; it can also measure how much, no, quantitate, no. And these are the to be used for screening the levels of neutralizing antibodies for patients who may be able to donate blood to treat severe cases of coronavirus. The downside to that is it's very difficult and still undergoing study right now whether the antibody testing can be used for early case detection. Because just like any other infectious disease of viral origin, the antibody takes time to go up before it becomes detectable in the bloodstream. And sometimes you need disease first and actively as having the symptoms. And then later on, it's the only time antibodies turn positive. So that's the part that would need further studies whether it can be used for early detection of active cases.
Now, doctor, as an infectious disease specialist, I'm sure a lot of people hear what the president said, and if maraming umaasa, no, na meron ng lunas itong dinadaanan natin, at marami, I'm sure, ang sabik na makabalik na sa mga normal nilang mga buhay. But as a infectious disease specialist, ano po ang realistic time frame po na meron tayong properly tested, efficient, potent antibody na pwedeng ibigay sa mga tao?
That's a very difficult question to answer. Kasi not all point of care tests for antibody testing are created equal. No? And there are so many factors affecting the diagnostic sensitivity of the test. It's not because it's not done properly. It's just there are both intrinsic to the test, which means if the design is good, and there is also extrinsic to the test, meaning the antibody response of a patient may not be that high enough to be detected by the test. So to be able to provide each of these technologies available already in the market that will answer your question, it needs to be properly tested and validated. Confirmed cases of coronaviruses. Confirmed meaning when you combine both a positive testing for the coronavirus plus the clinical symptoms, and then you collect samples at baseline, and then you collect another one when the patient is recovering, and then you identify the antibody response based on that. So we call it the acute and convalescent serum testing. And it will have its own gradation based on the days of collection related to the time the patient develops symptoms. For example, if the patient develops symptoms at day 1, and then they tested positive for the virus by another platform like PCR, and then they will sample at day 1, and then they will continuously monitor the blood samples towards until the time the patient is uh, 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 has recovered, and then you will be able to determine the time to positivity. At what day of illness did the test actually tested positive already? And if it says it tested positive of at day 4, day 5, we would say at day 5, how many patients among, for example, let's say arbitrarily, let's draw a number, let's say, how many among those 100 patients tested positive at day 5? How many tested positive at day 7? How many tested positive at day 14? But if our, and how many tested positive at day 1? No? So if the sensitivity or the number of patients being captured at day 1 is high enough for a diagnostic threshold, this can become a tool for early diagnosis. But if it's being positive well beyond the period of the disease, then it can become a useful tool to determine if you had a disease. So that kind of evaluation can be very useful in answering the at what time illness can actually use the test kit.
Okay, doctor, let's answer some questions from social media. No, we have a question from Ems, and she would like to know, I saw online other countries use saliva as samples. Ganito din po ba sa atin? So I guess Ems is referring to yung testing kits, ano? Nakita niya sa iba na saliva ginagamit. Pareho din ba dito sa atin?
There are several sample source that the testing can do. Even HIV before use saliva testing. It has something to do on what are the likely source of sample from the body that has greater concentration of the virus. No? So if it's a saliva test, most likely they are trying to identify the presence of the virus rather than the presence of the antibody. No? Because there is abundance of the antibody mostly in the blood, but you see several forms of antibody in other body types which can be measured. But for a saliva test, I'm assuming, because I'm not familiar what kind of test stage the color or the message, the texture is alluding to. Most of the time, it is an antigen-based detection, and again, it has something to do with how much of the virus actually present in the saliva.
Okay. Doctor, still on that question, no? A follow-up question to that. A follow-up question to that testing question is, how efficient ang mga tests na ginagamit natin na ngayon nagma-mass testing po tayo? Ano yung time frame? Gaano katagal bago malaman yung resulta? How does this compare with yung mga foreign branded testing kits?
Well, I'm not sure if I'm the person to answer the question because I'm not directly involved in the implementation plan for the mass testing. But if I will just follow the usual behavior for laboratory testing for PCR technology, for example, if they have this, if the testing are decentralized, the turnaround time will really improve because parang it would come out like we share the burden already and it's no longer being shouldered by one testing. So I would
Doctor,
think that it's
Doctor,
logical.
can we be assured?
Yes.
Can we be assured because there were several reports before. There were several reports before of a foreign test kit that wasn't so efficient. Maraming mga false positive. Can the people being tested now at least have some security knowing na maganda yung mga test kits na nabili na natin or yung ginagamit sa mga tao ngayon ay mas maganda na?
Well, every test kasi that is available in the world has its own share of false positive and false negative, no? And those are inherent to any test that is actually present, no? Beyond coronavirus. If you are in an epidemic, you want a test that identifies the disease more than identifies the disease less, no? So it becomes so an advantage, no? In terms of the false positive results, I think the one that they're using has acceptable numbers beyond that, with that longer. That we really don't want are false negatives, no? Because even if it's a false positive, the management, the flag sign will be up, and the monitoring will be much better, and you cover as much. But if the major problem is too much false negative, the guards will go down, and it will really affect the behavior. So, but
Okay.
if you have more patient testing positive, then intervention becomes more obsessive compulsive. It becomes more beneficial to the community. Uh, the most important thing there is you do not lay your entire assessment on the results of the test alone. No, that's why it requires the clinical team to correlate what the patient is presenting and whether the result is compatible with the patient's clinical data. And always case for all diagnostic tests, and test for coronavirus is not exempt from this kind of behavior. No? So
Okay.
I don't have data on the testing kits
Yes.
on false positivity and those that they are using.
Okay. But at least rest assured, the people who are going into testing or the testing kits available are at least within the limits na okay silang gamitin. Pwede silang gamitin, makakuha tayo ng magandang mga resulta at mga resulta magagamit po natin sa paglaban ng COVID-19. Okay, with that, we'd like to thank you, Dr. Raul Destura, for all your work actually in trying. Your work is instrumental in this fight against COVID-19. And with that, we'd like to thank you very much for joining us today and sharing your knowledge with us.
Thank you so much. Thank you, Fred. Thank you for having me.
Okay, and we'd like to thank all of you viewers out there who sent their questions. Please keep on sending those questions as we are here every day, Monday to Friday, 3:30 p.m. to answer those questions or keep those coming in. So thank you again for watching. We hope that this COVID-19 testing kits will have a significant impact in flattening the curve. I'll see you again tomorrow at 3:30 p.m. I'm Dr. Freddie Gomez. Thank you for watching.